Hi everyone, I am very excited to share everything I learned with you, and I am excited to learn from you as well. This program was designed after looking at CHAPLAINS because they have an 83.2% burnout rate. The study surveyed 534 chaplains living in the United States. I looked at the practices that worked and didn't work for them. Burnout is a job stress. Here are the symptoms of burnout. You might experience emotional exhaustion. You might have feelings of negativity or ineffectiveness. You feel you don't have enough support at work, and you feel you are working hard yet not accomplishing anything. There are 4 factors that contribute to burnout. The first factor is compassion satisfaction. If you have positive compassion satisfaction, you are likely to combat burnout. Those with higher compassion satisfaction can find a purpose and can find meaning in life, and they feel they have a higher calling. You can easily find motivation and inspiration, and you have better job performance. The second factor is secondary traumatic stress, STS. It's very similar to PTSD in that it shares having flashbacks, nightmares, and intrusive thoughts. Compassion fatigue is included in this category because it is when the helper feel an enormous stress because of working with trauma survivors. It prevents you from establishing personal and professional boundaries because you want to help the patient more, but you can't, and you take on their pain and suffering. The third factor to burnout is mindful self-care. Those who have positive mindful self-care can easily combat burnout. Those who do not have positive self-care will experience conflict in their personal and professional life. They will feel disconnected from other people. They may turn to drugs, alcohol, and other methods to cope with the stress. Lastly, organizational factor is a contributor to burnout. This is when you feel ineffectiveness, where there's no opportunity for decision making, and the long work hours and unmanageable cases contribute to your ineffectiveness. You also feel a threat to your safety, such as those working in the hospitals may feel unsafe working there because of COVID. Now let's talk about preventive care. Maslow's triangle of needs will be repeated throughout this program. For the chaplains, they feel that the first 4 needs were unmet, and they try to satisfy those by coming up with practices to adapt to those needs. For us to be the best version of ourselves, these needs to be met. Self-care is an individual process. We all have different needs because different stages of life. The process to adding self-care to your routine is first you need to identify your needs, then explore the practices to satisfy those needs, track your progress, and then evaluate whether it's working and make modification if needed. The first method to inventorying your need is to track or chart which area of the Maslow's triangle are unmet. Because when you are talking about emotion, it's something you cannot see. So if you have a chart, it's helpful when you are evaluating. The second method is to write it out. Some people like to write in sentences or to say it out. For example, I need a car to get food. Some people tend to misidentify needs and practices. The need here is food, whereas most people might say a car is the need. So understanding your need and getting down to the root need is essential to your process. So that's all for today. Thank you for joining me, and I will see you next time. Have a good day.